Should I sit back? Oh, I don't want to.
You're live, Bob.
So should I just start right away?
Yeah, you're actually live. Like,
I'm on
anybody
right
that
now.
watches will see this.
Well, does it tell you as people kick on?
Yes, it
So
does.
should I just wait for people to start kicking on?
You can do it.
Interesting. Can we edit this at the end? No, so it's live right now. So I should just start rambling then.
So yeah, I was just giving him a little bit. You can explain about yourself because then anybody signs on will know you.
Okay. So this is Bob Stephanos. I am the Director of Medicine at Revive Proactive Health. Actually, Administrative Director. The Director of Medicine is Dr. Gary Thomas. We have multiple locations here in Florida and also in Texas and California. Today, what we're going to speak about is hormonal optimization. A lot of people are seeing the low T commercials. They're wondering about it. A lot of men are hitting the andropause, or they don't feel great when they hit their mid-30s and 40s. And there's a process and there's a way to do this medically supervised that is safe, effective, and incredibly life-changing. The thing is that there are a lot of people out there today, a lot of clinics out there today, just don't do it correctly. They go out, it's a chop shop situation where everybody gets the same dosage. They're not dosing the patients on a customized basis. So, am I still live?
Yes, you are.
Okay, so
if you look right there at where the camera is, then it looks like
gotcha.
you're
Okay,
the people.
so the process of hormonal optimization. What do you feel like? What are the symptoms? Fatigue, chronic fatigue, body composition issues, libido, sex drive issues, and so forth. Cloudy memory, moodiness. All these things can be attributed to hormone replacement or hormone deficiency. The problem is that they're misdiagnosed usually, or they're treated with some other type of antidepressant or something else, or they're not done correctly. The process is getting a full screen blood work done that shows everything. Metabolic function. Metabolic function, why? Because if you're not managing your sugars, your glucose, your hypoglycemic, for instance, you could be very tired from that. There's a huge percentage of people out there today that are walking around pre-diabetic or type 2 diabetic. And we find that out because they're not managing their sugars. They're becoming insulin resistant, and it makes them tired. They put a lot of weight on and so forth. Many women out there today have big issues with
There you go, you're back on.
Many people don't understand that the reference range regarding thyroid is really wide, and it's generally accepted as a wide thing. But there are new studies out there. It's a much tighter, more defined range for thyroid. And what does thyroid do? It's incredibly important for your metabolism, how your body temperature, your energy level, and so forth. So a lot of people walking around in this funk, and they might be treated with antidepressants, Xanax, and so forth, and it has nothing to do. They have to adjust their dosage or get on a thyroid program. So what we do at Revive Proactive Health
Before we keep going too far, Emmanuel Banks, I'm guessing that's the IFBB Pro Emmanuel Banks, just asked, at what age should one get checked?
If you're symptomatic, you should be being treated right away to find out what the root is. Usually with hormone replacement, we started around 30, the early 30s. If you take a look at professional athletes, for instance, it's incredible when you see a running back in the NFL at 30, 31 years old, they're talking that he's over the hill. His hormonal ability is starting to show itself at that peak physical or athletic performance. He can't recover as soon or as quickly as just a few years ago. Now we know that's what's going on. His physiology is slowing down. He needs bigger intervals of time to recover. So when it comes to hormone replacement therapy, once you become symptomatic, you want to check everything out. Thyroid. You want to check your free and total testosterone out, the estrogen values, the prolactin numbers. Those are all important things. The other thing too is inflammatory markers. Cortisol, another hormone that is produced to protect the body over a long period of time. What it does do is it actually hurts the body. You hear about body composition issues. Too much cortisol may get you more body fat and so forth. The issue is that It's there, it's a stress hormone, but when it's reproduced, it's so constantly because of induced stress, adrenal fatigue. People today are drinking left and right, all kinds of energy drinks, and we've got a whole generation of people that are going to have incredible adrenal fatigue issues because they can't function without hundreds and hundreds of thousands of milligrams of caffeine and stimulants in their system. So a general age is in the 30s. Get your baselines done. See what you're working with optimally. Therefore, you can take a look and always refer back to when you're healthy. When you get sick, medicine is a practice of a process of elimination. So the most obvious things will become very apparent on lab work. And what happens is we rule those things out. So if you have a family history of slightly higher liver enzymes and you have a record of that, if you get sick, the doctor isn't going to gravitate to that. So the point is take a look at all the things and get a big wide angle of how your whole body and how your physiology works and how we work hormonally. We talked about insulin, diabetes, high blood pressure. All these things can be correlated to hormone deficiency or these other things. So you want to be aware that, hey, I'm not a diabetic. I don't have issues with my thyroid. And then we process it down. Then we take a look at when men start to ebb in terms of hormone production, and women too. Women have, for long periods of time because of menopause have been addressing that. Now we know with like books from Suzanne Summers and so forth that there's an incredible breakthrough in new age type of treatment when it comes to hormone replacement therapy. So women need to be treated similarly. We got to take a look at those anti-inflammatory markers. We take a look at homocysteine, C-reactive protein, see if there's cardiovascular information. There's things that you can address and you can be preventive and proactive when it comes to your health. And too many people today are waiting too long, or they're not being treated specifically. A lot of people are out there today, a lot of physicians, you can throw a rock in any direction, you can hit a hormone replacement therapy clinic. And we get a lot of those patients that come to us with lab work that just aren't medically supervised. We see men that are on testosterone therapy with incredible amounts of estrogen in their system because they're not being tested or they're not using a proper estrogen protocol. And estrogen usually is typified, both men and women produce it, but most people associate with women. And too much estrogen causes water retention, hypertension, moodiness, body composition issues, and it has to be managed. As you grow older, men produce more and more estrogen and their testosterone levels go down. So therefore we have issues with mood, libido, body composition, and so forth. So we want to take a look at that, and a lot of doctors don't. We see patients that have been treated for years through doctors, and they come in with incredible blood density issues. They come in with their red blood cell counts that are very high. It gives them very high risk of clotting, stroke, and it's a simple thing to take care of. I mean, 20% of men have this condition, and it can get exacerbated with hormone replacement therapy. But if it's monitored, it's no big deal at all. It's basically a donation of blood. Every 56 days or every couple of months, you donate a pint of blood, which is great, and it really helps your physiology. But if you're not supervised, what happens over the course of time, blood becomes thick, it gets like oil, blood pressure goes up, your risk of heart disease, stroke, and so forth go up also. So those are things that I see on a regular basis. So when it comes to optimization, what is optimization? Because we take a look at some of the reference ranges, and I'm 50 years old, 55 years old, and you'll see reference ranges that for a guy my age for testosterone is 200 to 900. Well, that's a really wide range. What you have to find is what is optimal, and that's what's important here is not so much what the lab work says, is what the symptomology is. If I come in and I have lousy endurance and stamina and my sex drive is low and my body composition doesn't look good and so forth, and I'm not responding well, my cognitive function, I'm depressed or I can't think clearly, is obviously some symptomology. So the blood work then fills in the gaps. Then we take a look at testosterone. Testosterone is an incredible hormone because what it does, it accelerates cellular metabolism. That means, in a nutshell, the metabolism of cells as it works. the respiration, the gas exchange, the way we breathe and absorb oxygen, the way we manage waste management, nutrient exchange. You can eat the best things, supplement the greatest way. But if you're not metabolizing and using these things and expelling waste, your body slows down, retains more waste, causes more inflammation. More inflammation, more disease. People talk about being alkaline and disease-free and cutting inflammation down. The way to do that is change the filtration system in your body. You can do that in many ways. Along with hormone replacement therapy, what we do here is we do great nutritional coaching. Supplementation that's specific to the patient. Too many places just have a cookie cutter approach where it comes down to, okay, you're a guy, you're going to get this amount of this, this, and this. And what happens initially, you'll have a good response from it because your body needs something. But the problem is, like any medication, if you don't do it correctly, textbook immunity happens. So there's got to be an ongoing process of changing and fine-tuning and tweaking the hormonal system, along with the nutrition. If you train all the time, for instance, guys who work out all the time, they understand that you have to change your repertoire when it comes to training to stimulate the body. It will get immune to it. It adapts to it. Same thing with hormone replacement therapy. Same thing with a lot of different medications. So you'll see a lot of different medications that are out there. And then women want to know about hormone replacement therapy because it's second nature when it comes to menopause. But even before that, women have issues with body composition issues, energy, libido, long before they get into menopause. They don't understand why. And that can be due to thyroid problems. That can be due to the sex hormones, the estrogen, the testosterone. Women produce testosterone also. They do it through their adrenal system. So it's one of those things where there are issues because testosterone, if you take too much of it, does virilize. And otherwise, it causes male-type side effects and androgenization. So what you do, there are medications that have been modified that women can take, get the benefit, the energy, the sex drive back, the body composition back, without the risk of facial hair, deepening of the voice, a receding hairline, the things that men typically get. So those are things that a lot of doctors aren't aware of or they're not schooled in. And we've been doing this for over 15 years now. The issue is awareness. People aren't aware of what goes on. They just see what the general media throws out at you. So at the end of the day, you've got to make sure that you're being medically supervised with a proven program. So we take a look at it from the supplemental. We take a look at physiologically with blood work. The doctor looks you over, and we stay in contact with you on a regular basis. Then from that point, it's just a matter of doing the appropriate medications that the doctor deems appropriate for you, and then finding a follow-up, doing follow-up from that point on. So that's basically how we start with patients when they first come in. We've got to get extensive blood work done. This is more than you'd ever get at a regular annual physical. People bring blood work to us all the time. It's not comprehensive enough. Usually it's age appropriate. So, obviously 25-year-old people coming in, they don't need hormone replacement therapy. If they did, they'd already have, they'd be well aware of it. So usually when you get into your 30s, you start to see a decline. That's when you usually see symptomology also. And so we test that way. So we're seeing people 30 to 70 years old on a regular basis that want a better quality of life. They want to be proactive. So people come in here, and when they want to, they might be successful in other parts of it, but their bodies, they've neglected it. So they'll come in and they'll say, hey, you know what? I want to stick around. I really want to, enjoy the fruits of my labor with my family and so forth. They get tested, get on a program, and from that point on, it's all about just monitoring and fine-tuning the system. So if there's any questions, just pipe in whenever you guys want to, anything specifically that you want to look over. There are different things that when we coach people also, in terms of resting and sleep and issues of lifestyle changes that are really important that will affect metabolism also. And the quality of sleep, for instance, I'll just touch on this, be a little specific. A lot of guys just don't get a lot of sleep because of stress or whatever. There's specific things. If you don't get into deep REM sleep, you're not going to have proper hormonal cascading that normally occurs when you get into deep sleep. And people leave their TV on, they let the pet jump on the bed with them, they have young children, whatever it may be, but it's important to get deep sleep. And they say, well, I just can't have it. I'm a swing shift guy. I have law enforcement people that, they're off 3 days on, 3 days, things like that. There are studies that show, and a lot of professional athletes now, what they do is as soon as they become aware of this, we put them into a program where we teach them to meditate, do connected breathing, yoga, things that can calm the body down, even napping. We nap children. Now what we do is we tell people to nap. We tell people, there should be a time where you do that mid-afternoon type of 20 to 40 minute timeout. Shut the phone off, turn down the lights, do some sort of, if you can't take a nap, do connected breathing. You will catch your second wind. And basically what you're doing is you're just calming the body and letting it recover a little bit. If you try that, that's an incredible thing also. Yes, I mean, there are many cases when it comes to testosterone deficiency. Bill's asking if we treat ED. ED is real prevalent. It's sometimes, most of the time, it's symptomatic of other issues, hormone deficiency, body composition issues. And to affect that, you don't always have to do a drug, a vasodilator like Viagra, Cialis, or something like that. Although, the doctors do prescribe that. The issue is that if you get into optimal condition, you get good cardiovascular condition, guess what? Usually those things take care of themselves. When you're diabetic and you have high blood pressure, or you're pre-diabetic, or you're not in good condition, nature has its way of preventing you from going on and having being optimal in your sexual condition, your breeding. Only the really strong, well-conditioned animals typically are in good condition to breed. So if you're not in good condition, get yourself in good condition. If you don't have good stamina in bed, guess what? Do intensive cardio. Intensive cardio will give you more stamina. Then if it's a vasodilation issue, we look at that. If there's a diabetes issue, we look at that. If there's high blood pressure, we look at that. But you know what? Coupled with hormone replacement therapy, testosterone is one of the strongest hormones that you're going to use in terms of sex drive and endurance. You're gonna see a big difference. Jay's asking, do you have to cycle hormones or do you medicate year round? Cycling is typically a term that goes back to bodybuilding. So men who use this for performance enhancement, they're going to go on for a specific amount of time for the season or the event they're going to do. Hormone replacement therapy is typically you're going to go on a therapy and stay on a therapy. There's fine tuning, the dosages can vary, the medications can vary, but typically when you're hormone deficient, once you feel optimal, why would you come off? Unless there's an issue with fertility or something like that. There's some cases that people think that, I'm not going to be fertile, I'm not going to have children. So you know what? They're going to stay on all the time. Other people will say, you know what? Certain types of testosterone interferes with sperm production and fertility. So what they'll do is they'll go on therapy. And then when they think, hey, you know what? I need to take a break and maybe have kids, they'll use transitionary medications that stimulate and jumpstart their system. And they go on from there. They have their children, and usually once things get good, they go back on therapy again. So if you're deficient in thyroid, you wouldn't cycle thyroid. Or if you're deficient in a different medication, you go on, you'll get into that optimal range, and you stay there. So there are different things that you can do along with that. That are important, and that's where medical supervision comes in. Doing regular blood work on a regular basis. If you have high cholesterol and the doctor puts you on Lipitor, we now know 20% of Lipitor users have liver issues. Well, guess what? If we don't supervise you, 20% of people taking that medication, one of the most popular cholesterol medications, are going to do damage to you. So what we do is we put you on a medication. We see that your baseline numbers, we fill the gaps in, and then we can come back and we're gonna test you again. We're gonna see if there's any interference or any optimization or fine tuning that needs to be done, or do we need to change the medication out? With any medication, no matter what it is, the one and done tests are not appropriate, and you're not being medically supervised. It goes back to seeing these guys that come in with high density blood issues. I come in, I'm looking at this guy, he looks like he's in pretty good shape from 20 feet away. Then when he comes up to me, I realize his face looks like a pumpkin, he's bloated, he's holding a ton of water. That's edema, subcutaneous edema. And I check his blood pressure, it's out of whack. And he does 45 minutes of cardio every morning. Guess what? He needs to donate right away. We checked his blood work out. He had estrogen of a woman having her menstrual cycle. It was insane. And, he donated a couple times, got that blood pressure down. And you know what? All of a sudden he felt like $1 million. And this was a doctor that came to see us, saw our doctor. He's being treated by his, and all of a sudden we're like, wow, this guy's not even looking after you. You need to have somebody supervising you when you look at this thing. And it's about access. You've got to be able to text or call. That's the way this system is set up. It's just set up where we have people that are knowledgeable, but we have direct access to the physicians on a regular basis. So if there is a question, it's already, you have complete access, whether it's during the weekday or it's on a weekend. So what was the other question?
Can hormone imbalance cause skin issues like acne?
Yeah, hormone imbalance can cause your fingernails to crack, your skin to crack. You can have acne, you can have rashes. Hormonal imbalance is, hormones fundamentally what they'll do is they are the gatekeepers for cellular metabolism. So if you're deficient one way or the other, then something isn't getting in that should get in. And you need to have hormonal balance. If your hormones are overactive, for instance, if we go back to thyroid, hair thins out. Your body temperature can take off. When your body temperature takes off, not only you get really tired, but you can also develop heat rashes and so forth. Acne. If you have a history of when you first go on testosterone, guess what? Testosterone, just like going through puberty again, if you go from deficient to optimal again, there could be a transitionary period or induction period that there could be a slight acne breakout. But you know what? There's a whole protocol that's done along with that. So what we do is preemptively or proactively, we talk to the patient. We find out during puberty, how's your skin? Were you oily? Were you more prone? Based on your ethnicity, that can have a lot to do with estrogen and so forth in terms of water retention or gynecomastia, another condition that can happen. So proactively, we know before, not only from the blood work, but from the interview the doctor does with the patient, is this person going to be more, for instance, estrogen dominant? Does he have an estrogen dominance? So we proactively can start a schedule that's custom to manage that estrogen. So you know what? He doesn't put on that extra water weight or have issues with gynecomastia or acne and so forth. So his blood pressure is good. It's managed right away. Too many clinics out there right now, they wait for something to happen. They wait for the patient to call back and say, hey, I have issues. And that's reactive medicine. That's not proactive medicine. Reactive medicine is waiting for the patient to call you, I'm sick, oh, now we got to fix it. Through 15 years of experience, what we've learned that there are certain types of people, certain types of blood work, and the doctor understands this, and he has a customized therapy for you. And the beauty of that is you don't have that phone call saying, hey, there's something wrong. And you get all the benefits from it. You have better body composition, the endurance, all the things that people talk about, the sex drive, the cognitive function, it's all there. It all works. There's no denying it. It's getting it done properly, doing it under proper medical supervision. So there's a question. My doctor gives me shots of testosterone, but never has brought up estrogen at first. I felt better, but nothing. And that's a perfect example of what we just spoke of. You go in, you get your total testosterone. You might be a little bit deficient, so your doctor says, "I'll give you shots." So you go in, and not only isn't cost effective, but what happens is he's not taking into account the estrogen. What happens is as you use testosterone, there's a certain amount of it that converts to estrogen. It cascades. It's not a linear hormone. It breaks into different things. So initially, you're going to feel great, like we said. But what happens? The estrogen starts to climb and catches up with the total testosterone. So what happens is 6 months, you say, hey, you know what? I don't feel like I did initially. Well, what happens is they'll increase the dose. Increasing dose increases the side effect ratio. So what you want to do is stay at a safe, effective dose that's 0 side effect dosages. And that's by managing estrogen. So you take a couple pills, for instance, a week that control estrogen. Therefore, you keep the proper ratio of testosterone and estrogen Too much of one or the other is no good. It's the proper amount, the zero side effect dose that is effective. And that's what happens. A lot of people aren't paying attention to those other ancillary hormones. So men, when they come in and they're 40 and 50 years old, that have high estrogen values, they don't understand because, their testosterone values are pretty good too. Well, high estrogen is very competitive, the same receptors that the testosterone is. They interfere with conductivity. They have what's called a high affinity to binding. So in other words, that estrogen that's in your body, even though it might be per deciliter a lot lower, what it does, it interferes. It blocks free testosterone. And the name of the game is that you're not your total testosterone, but your bioavailable or free testosterone. When you have a good ratio of free testosterone, you have the antagonistic hormones under control. And you mentioned estrogen, but estrogen is just one of many. Cortisol, making sure the thyroid works right, making sure that you're managing your sugars and so forth. It's very important that all those other things are working properly. That's why we do the extensive blood work. And therefore, free testosterone is high. You get all the benefits from it and really none of the side effects. And then you're going to have better cardiovascular health, better blood pressure, better body composition. As a man, can this cause what's called bitch tits, excessive breast tissue? Yes, it can. Testosterone in itself doesn't do that, but what happens is the high excessive estrogen values. I'll give you a little scenario. People associate, it's called gynecomastia, bitch tits, or the swelling, and it can manifest itself in a couple ways. It can be the lumps or nodules, or the whole breast can grow, and that's because we've evolved with a lot of estrogen receptors around here. Women, when they go through puberty, the estrogen causes them to grow. We don't get the surge of estrogen that women have, but a certain percentage do get that surge when they go through puberty. And that goes back to the symptomology or the profiling. Certain ethnicities, if you were a chubby little kid, you have a more propensity as a child going through puberty to develop gynecomastia, or the bitch tits. So what happens is, in that area, you're at risk. When you go on a testosterone therapy, you're at risk if you're not managing it. So every patient that we have manages estrogen along with the testosterone in one of two ways. We do two different medications, or actually there's 4 different medications that are appropriate. So we use those protocols so you never have that issue. If you talk to any plastic surgeon that does that type of therapy, I can tell you firsthand, most of the people that come in for gynecomastia surgery, where they have to physically have a surgical procedure to take that tissue out, are 2. And people usually, it must be bodybuilders. It's not, though. It's children going through puberty and older men over 45 years old, 45, 50 years old. Men come to us all the time. They say, you know what? I eat the same, I train the same, but look at me, my body, it's getting soft, and I'm getting man boobs. Because hormonally, testosterone's going down, estrogen goes up, estrogen binds the receptors, swelling occurs, or tumor-like nodules occur in their chest, and guess what? There's where most of your people, most of the surgeons out there are getting their business from. Now that we have this surgeon low T, and a lot of physicians are not managing these patients correctly, now we have a whole new subset. So you're making a lot of plastic surgeons happy that do the procedure, because now they have a new group that's really starting to explode. And it's totally preventable. The hypertension, the blood density issues, the estrogen-related side effects, the prostate issues are totally avoidable if they're done with proper management, proper medical supervision.
Just to cut you off, we have about 1.5 minutes, and Facebook will cut us off.
Okay, so we're being cut off. I covered a lot of topics. If you want to get in touch with me, you can email me at bob@revivehrt.com, and I could speak to you specifically about your concerns and so forth. Okay, but it was great talking to you guys, and we're going to do this on a regular basis. I'm going to do some more specific things to do with training, nutrition, other people than myself. But thanks for tuning in.
Thank you, guys. We will be on again next week on Wednesday. Works.
Wednesdays are good.
Wednesday at noon, and we will post ahead of time what the topic will be. So make sure you tune in. If you guys want anything specific, feel free to message us on the Facebook page. on Instagram or email Bob, like he said, Bob at Revive HRT, and we'll do this again. Thanks, everyone.
Take care.